السلام عليكم ورحمة الله وبركاته. معكم حسن علي، طالب سنة رابعة من جامعة الإمام عبد الرحمن بن فيصل، واليوم راح نتكلم عن selecting the ventilator and the mood. Today I will talk about non-invasive ventilation, invasive ventilation, fully and partially ventilatory support, types of breath delivery, and modes of ventilation. We will start with what is the non-invasive ventilation. Is delivery of ventilatory support to the lungs without using endotracheal or tracheostomy tube. Is the photo. And the common modes are CPAP and BiPAP. CPAP applies continuous pressure to have a baseline. BiPAP applies pressure during expiratory phase greater than the pressure during expiratory. Continuous positive airway pressure CPAP, bi-level positive airway pressure BiPAP. Now I will talk about the advantage and complications. The first and more important advantage is it's non-invasive, no need to insert anything inside the body. Comfort, can be applied intermediately, less need of sedation, avoid complications of endotracheal tubes, oral patency. And the complications are mask discomfort, facial skin ulcer, leak, gastric insufflation, aspiration, and nasal and oral dryness. Clinical conditions and weaning. The most clinical conditions will have improvement with non-invasive are acute COPD patient, hypoxemic respiratory failure, cardiogenic pulmonary edema, weaning from the non-invasive, and chronic care. Weaning from non-invasive ventilation may occur within hours or few days. IPAP gradually reduced to the minimal level. If work of breathing vital signs ABG are acceptable, mask can be taken off. Risk factors for non-invasive ventilation failure: reduced level of consciousness, pH less than 7.25, respiratory rate more than 35, agitation, excessive secretion, poor tolerance, no initial improvement within the first 2 hours of non-invasive ventilation. What is invasive ventilation? Is delivery of ventilatory support to the lungs using endotracheal or tracheostomy tubes. Full and partial ventilatory support. Fully support, ventilator will provide all the energy to maintain effective alveolar ventilation. Partially support, ventilator will provide small energy with the presence of patient work of a breath to maintain effective alveolar ventilation. Type of breath delivery. Mandatory, which the ventilator control everything. Spontaneous, which the patient will control. Assisted, have features of both mandatory and spontaneous breath. All or part of the breath is done by the ventilator. Modes of ventilation. Mandatory modes is appropriate only when a patient cannot make effort to breathe because of drug, spinal cord or phrenic nerve injury, motor nerve paralysis. Spontaneous modes. With this mode, patients can breathe alone through ventilatory circuit without receiving any mandatory breaths. Assisted modes is like mandatory, but although the patient can trigger breaths, but the set volume or pressure is delivered same with each breath. Controlled mandatory ventilation. Ventilator delivers the set tidal volume or pressure. Patient cannot trigger. Indication: scissors. Trauma stops effort to breathe. Complications: muscle atrophy, dyssynchrony. Assist control. Ventilator deliver the set tidal volume or pressure and the patient can trigger. Indication: fully ventilatory support. Provide ventilation when spontaneous efforts are weak. Complication: can cause alveolar hyperventilation. SIMV. Ventilator delivers the set tidal volume or pressure and the patient can take spontaneous breaths between them. Patient can trigger. Indication: maintain respiratory muscle strength, facilitating weaning. SIMV window. As you'll see here, we set the rate on 6 and the breath cycle on 3. So we will calculate the total cycle, 60 over 6 from here. It will give us 10 seconds. Then we set the breath cycle, mechanical cycle 3 seconds. So 10 is the total cycle and 3 is the mandatory cycle, will give us the spontaneous cycle or spontaneous time is 7 seconds. So the patient can take spontaneous breath in this 7 seconds. Spontaneous modes. The ventilation is triggered from the patient, no mandatory breaths. Two common types: pressure support ventilation and continuous positive airway pressure. If the patient stop triggering apnea, the ventilator will switch to the backup mode. إذا المريض وقف عن التنفس اللي هو المصطلح اللي نقول عنه أبينيا، راح يحول الجهاز إلى الباكب مود أو المود الاحتياطي. هذه الخاتمة ويعطيكم العافية. استقبل الأسئلة وتعليقاتكم، وإذا كان عند أي أحد ملاحظة أو في خطأ في البرزنتيشن قولوا لي في الخاص، وشكرا للمجموعة لأنها اتاحت لي هذه الفرصة.